This is the LED which acutely takes an angle and comes up on the surface, and this is where the muscle is, the myocardium, and there was a bridge here, this much bridge. So this bridge we have cut out, and from here then this contracts, so this becomes an acute angle. That is how patient gets angina.
Hello everyone, my name is Mohammad Waris. I belong to district Muradabad, state Uttar Pradesh. I am suffering from myocardial bridge since 6 years last. मैंने बहुत से डॉक्टर्स से परामर्श किया. मेरी 5 बार कन्वेंशनल एंजियोग्राफी हो चुकी है और 2 बार सीटी कोरोनरी एंजियोग्राफी हो चुकी है. हर एक में मायोकार्डियल ब्रीचिंग आया. मैं जिस डॉक्टर के पास भी जाता था, हर डॉक्टर्स बीटा ब्लॉकर्स, कैल्शियम चैनल ब्लॉकर्स पर मुझे एडवाइस करते थे, लेकिन शुरू के वर्षों में तो मुझे सिम्टम्स इसके कम आए. शॉर्टनेस ऑफ ब्रेथ और चलने फिरने में तकलीफ, सीने में दर्द, ये शुरू के 1-2 वर्ष में कम रहे, लेकिन धीरे धीरे ये सिम्टम्स बढ़ते चले गए. और मैंने इंटरनेट के ज़रिए और जानने वालों के ज़रिए इसके बारे में जानकारी करनी शुरू की, तो मुझे इसका इलाज सही से नहीं मिल पा रहा था. इंटरनेट के ज़रिए डॉक्टर पवन कुमार सर के बारे में पता लगा, जो लीलावती हॉस्पिटल में कई वर्षों से प्रैक्टिस कर रहे हैं. मैंने आकर उनसे संपर्क किया, एडवाइस ली और अपनी पूरी रिपोर्ट्स दिखाई. उन्होंने कहा कि इसका इलाज केवल डीरूफिंग ही है. मैंने इनसे अपॉइंटमेंट लेकर अपना ओपन हार्ट सर्जरी करा लिया है, जिसमें डॉक्टर साहब ने डीरूफिंग कर दिया है. अब मैं अपने आप को बहुत ही हल्का महसूस कर रहा हूँ और मेरे चेस्ट का पेन भी चला गया है. अभी मायोकार्डियल ब्रीचिंग के बारे में अभी अवेयरनेस की कमी है, जिसके चलते मेरे जैसे बहुत लोग सिम्टम्स से परेशान हैं. चेस्ट पेन, शॉर्टनेस ऑफ ब्रेथ, थकान आदि की समस्याएं रहती हैं और उनको सही से इलाज नहीं मिल पाता है. कि उन लोगों को सही से इलाज मिले. मुझे लीलावती हॉस्पिटल का स्टाफ और डॉक्टर्स का व्यवहार बहुत अच्छा लगा और मिडिल क्लास फैमिली को इलाज कराने में यहाँ कोई प्रॉब्लम नहीं है. थैंक यू वेरी मच.
I am Dr. Pavan Kumar, consultant cardiac surgeon working at Lilavati Hospital, Mumbai, India since last 25 years. This is a very interesting case which I want to discuss of myocardial bridge coronary artery disease. This is a congenital anomaly where coronary arteries get covered by myocardium. The muscle goes over a certain part of the coronary artery, and when muscle contracts, the heart contracts in systole, this diameter of the artery, coronary artery, gets reduced. So with each systole it gets reduced, and with the diastole it gets expanded. But during systole, when the lumen gets compromised, there is a problem that patient gets chest pain. This abnormality is usually asymptomatic. A large number of patients remain asymptomatic, but in 2 to 6% cases diagnosed by coronary angiography, they do get symptoms of angina. They may get heart attacks, they may get arrhythmias, and they may fall into heart failures. Due to that, these patients are treated medically by beta blockers or calcium channel blockers, so that they dilate the lumen and blood flow gets augmented. But in some cases, not in all cases, where medical management fails and patient continues to get angina, then there is an option of surgery, heart surgery, open heart surgery, where we cut out this myocardial bridge, or myectomy do, or unroofing of that myocardial bridge is done with or without coronary artery bypass surgery. Many cases, atherosclerosis is also noted when the either proximal to myocardial bridge or distal to myocardial bridge, where the vessel takes an acute turn, and that's where the either blockage occurs or intima gets disrupted. So they do get coronary artery disease also in many cases. In this case also, I did coronary artery bypass surgery along with the by the left intermemory artery to left descending artery. In this patient, Mr. Muhammad Waris had a myocardial bridge in mid-third of left anterior descending artery, coronary arteries. And that's where we diagnosed. This diagnosis was made in 2018 and repeated angiographies were done, and he was put on medical management over last 4 years. But despite having full medical management, he continued to have angina. Last year, he had a minor heart attack in the same area of left anterior descending artery. So he again searched for the further options of treatment, and that's how he came to us for heart surgery for his myocardial bridge. We did CT scan of coronary arteries, and we showed clearly where exactly is the myocardial bridge, where exactly is the length and the depth of the myocardial bridge, and after delineating everything, we did heart surgery on him, and he is now totally relieved of his symptoms. We cut out the myocardial bridge and put a lima on him with the CABG to left anterior descending artery. So he is doing very well. I have done 4 such cases in last 25 years, but last 3 cases where a stent was deployed for this myocardial bridge. And although it is not recommended, but it was done, and as the expected, the stents got fractured. This fracture occurs because of the constant contraction and the relaxation of the heart muscle, and so stents do get fractured. And then the person gets back to the symptomatic state. And that's how I did last 3 cases where stents got fractured. So I did a CABG in those cases. But in this case, this is the first time we did a myocardial bridge removal along with the CABG. So this is the information which I want to pass on to you. Thank you very much.